Well, I'm doing it again today. I'm going behind the scenes to share with you what some scare tactics happening from Medicare sales agents are doing to put you in the wrong plan potentially and to pad their pockets. Today, I'm going to show you what's behind the scenes, how Medicare agents get paid, and why some of them are being incentivized to sell you the wrong plan, and it's based on us and not based on your best interest. But you be the judge. I'm going to show you behind the scenes and again, make our industry mad at me. Hi, my name is 𝗲𝗄𝗿 𝗟𝗏. I've been a licensed agent for more than 25 years, helping people with life insurance and health insurance, specifically with the world of Medicare. And what really bugs me, has always bugged me, is when people use scare tactics to push seniors into doing something that they want them to do, and that's what we're going to try to avoid today. So rather than being scared and choosing a plan based out of fear, I want you to choose a plan based out of risk avoidance, with knowledge. That's what YouTube is all about, right? Educating people with knowledge and not by fear. So how do excess charges work? The reason I'm bringing this up is there is a couple of people on YouTube that are spending hundreds of thousands of dollars per month to push videos into your dog streams and your cat streams and anything else you're watching on YouTube to make sure that they're number one, to very hyperly tell you that there's only one Medicare plan. It's got to be Plan G, and there's no other plan to consider because those other plans, those Plan N plans, will hit you with excess charges not accepted anywhere and all the rest. It's a crock because they don't sell that plan. And here today, I'm going to reveal for the first time why they don't. Something I think you should really know. So stick with me for a couple of minutes. I'm going to get there. Quick, some background. There are three types of providers on Medicare. They either accept Medicare assignment, Medicare in full. They don't accept Medicare assignment, but they still take Medicare, or they fully opt out of Medicare and you just can't go to them with Medicare. So quickly, let's touch on those. Of the first one, participating in Medicare, they will accept the Medicare fee schedule. No problem. They're not going to give you any trouble whatsoever. They're going to accept the Medicare fee schedule. And if you have a Medicare supplement, everything's taken care of. No excess charge potential there. Then there are other doctors. And by the way, the first one, this is 96 to 98% of providers out there that accept Medicare and Medicare assignment. So there's no potential of an excess charge. Not at all. So the first thing about that being a scare tactic is, wait a minute, if this is a potential excess charges of only 3 to 4% that it could possibly happen, should that be something I'm considering? No, and I'll share with you more why in a second. Let's look at the 3% of doctors who do not accept Medicare assignment as payment in full. And in a second, I'll show you how you can tell the difference and how you can find out if your doctor or your proposed doctor accepts Medicare assignment in full or not. So the second type of doctor, this is about the 3%. And according to the Kaiser Family Foundation, most of these are psychiatrists, by the way, or podiatrists that deal with your feet. So most everyone else does. If they don't accept Medicare assignment, they can still bill Medicare and your supplement will still pay toward the bill. However, if they don't accept Medicare assignment, see, they can't pay you, they can't accept payment for Medicare based on 100% of the Medicare fee schedule. Medicare won't allow it. If you are a doctor and you say, I'm not going to accept Medicare as payment in full, then the doctor has to back up a little bit and accept 95% of the fee schedule. So let's look at the example here. If your bill is $100, and by the way, when you get a bill from a Medicare provider, they'll say that they're billing Medicare. Let's say it's a $100 Medicare claim. They're going to say to Medicare, we want $400 for this visit. Medicare is going to laugh at them and rebill it based on Medicare guidelines and say, no, this is a $100 total claim. So in this non-participating situation, the doctor can't claim to Medicare $100 if it's a Medicare claim of $100. Why? Because this particular doctor, 3% out of all of them, has chosen not to accept Medicare assignment. So they have to go backwards and start at 95th percentile, 95% of the bill. By the way, doctors in these 8 states cannot, under any circumstances, charge excess charges. Little caveat, New York, it's capped at 5% excess charge. So in those states that you see listed right there, they can't charge excess charges, okay? Not at all. So the whole scare tactic of excess charges and why you shouldn't consider Plan N is thrown out the window in these states, but only 96 or 97% of the other states. So again, you go to the doctor, it's a $100 claim, 95% of that is what they can start with Medicare. But then Medicare is going to pay 80% of that bill, right? That leaves 9.25% for the patient to pay in addition to what the supplement would pay. So when you keep being told by these people on YouTube that you're going to get 15% of the bill charged, you're going to get charged 15% of the bill, that is a lie. That's not how it works. They reprice the bill to 95%, not 100% of the Medicare allowable. If this doctor is one of the ones that you're scaring people of and saying they don't accept Medicare assignment, which is a very small minority of doctors, but they have to start at 95th percentile. So in this case, it's a $100 Medicare claim, right? $95 of that is now allowed with this one doctor because he didn't accept Medicare assignment. So then $76 of that is paid by Medicare already. Then $19 of that is paid by your Medigap plan. And then the balance bill is $14.25 in this worst case scenario, which means the effective maximum excess charge is 9.25% in addition to the 100% of the bill. 9.25%. That's 9.25% is the worst case scenario. Now in my office, we've only done thousands and thousands and thousands of plan N cases where excess charges are not paid by people. And the most we've heard is a $14 excess charge. And it is very, very, very rare that we even hear that. So why then, if this happens in such a rare instance, why should an agent be pushing someone to avoid excess charges when they almost never happen? And if they do, it's no big deal at all. There may be a nefarious point to this. So there's an article from Kaiser Family Foundation that showed that most all the doctors are participating in Medicare. And then who is the last category of people who are opting out completely of Medicare? They are the doctors, in fact, that are specialists and they don't want anything to do with Medicare whatsoever. This equates to, right now, according to Medicare, 1% of providers. 1% have fully opted out of Medicare. You can't claim it. You can't file it with your supplement company. You can't file the claim with Medicare yourself. None of that. And the majority of those doing that is psychiatrists. And again, the others are podiatrists. They don't accept assignment. They don't accept Medicare at all. You can contract with those doctors now under a private arrangement, but they're just not in the Medicare system at all. So the question is, does my doctor, how do you find out if your doctor, in fact, accepts Medicare? It's very easy. I'll show you. You go to Medicare.gov and go under the providers tab there. And you'll see it's very easy under the providers. You just look for doctors and clinicians, or you can look at hospitals and the rest. And you type in their name and it'll show this provider accepts Medicare assignment as payment in full. And if you don't believe that, maybe you're saying that's not up to date. Call your doctor's office and ask them if they accept Medicare. If they accept Medicare, they'll accept every brand of Medicare supplement, first of all. You don't have to tell them, hey, I've got a Humana Medicare supplement plan or GPM or Federal Life Medicare supplement. Do you accept that brand? No, the question is, do you accept Medicare at all? And if you do, then the supplement automatically pays that bill. There is no network. There's no prior authorization. There's no checking ahead of time. If they accept Medicare, they're going to accept Medicare as direct payment, no matter which carrier you have. So you can find out, does your doctor fully accept Medicare assignment? And that is the question. You can find out on this website, Medicare.gov. That's easy. So here's the part that's going to get me in trouble. Sorry. This always gets me in trouble with the insurance industry by sharing too much information, but I think people really deserve to know. So I'm going to share with you behind the scenes. The national average agent commission, according to several sources out there, now this can vary by plan, can vary by state, can vary by product, but the average for a Medicare supplement plan, and we sell in all the states, so we know this, it's 22% of the premium. That's what your agent is getting. Before you freak out and say, wait a minute, I'm going to cut out the agent and I'm going to go straight to the insurance company. Well, guess what? You'll still pay the same rate. Why is that? Because the plan cannot be filed two different ways. To one, go through an agent and have an agent commission embedded, and two, go directly to the insurance company with a lower rate. They're the same rate either way. So you might as well have an agent advocate shop the plans for you, and I'll show you how we do that. Find the plans for you and enroll you in the plan and be accountable to you at each renewal so they can help you look at the marketplace and see if something's better. You're going to pay that 22%. It's embedded in the rate anyway. You might as well have somebody help you for free. You don't pay that on top of the premium. It's already included in your premium, just like your life insurance premium has a commission built in, just like your auto owners, just like your home insurance. They all have agent commissions built in, whether you go direct to a company and deal with their 800 number only, or you have someone to advocate for you. So that's just built into the rate. Of the 22% on Medicare supplement, let me just share with you some behind the scenes numbers here. Let me make it even larger. Here I'm looking at a, let's see, zip code 15068, New Kensington, Pennsylvania. We have thousands of clients in Pennsylvania. And again, we're coast to coast, but I'm looking at a 65-year-old female, brand new to Medicare, considering all of her Medicare options. And again, I'm calling out specifically those agents and agencies that only present Plan G. Here's why they're doing it, folks. They'll tell you, and yes, as age 65 is a testament to, you're going to have the lowest rates possible in the entire world because you're age 65. Those rates will go up as you age and as you're in the plan longer. But where you start really, really matters. And what we're looking at is Plan G, and I'll show you what is Plan G here in a second. Plan G starts at a whopping 26.7% average difference higher than Plan N. Wait a minute, we just talked about the agent is getting 22% of whatever premium you make. Premium payment automatically made to the insurance company goes to the agent. So if an agent is only showing you a plan that's paying 27% more, that you're paying 27% more than any other plan, does that beg to differ? Is there an economic incentive here for the agent not to show Plan N? Or worse, to instill within you fear of this thing, the unknown, the excess charge, as if it's going to ruin you financially for the rest of your Medicare career? Quite the opposite, actually. And I've done the research to prove otherwise. So here are the Plan G rates in this area we sell for all these companies. Here's the Plan N rates in all this area. Now, I'll be honest and completely forthright here and let you know that our office sells about 85% Plan N. Why is that? Because we listen and take the time to find out, how often do you go to the doctor? How is your health? Who are the doctors you go to? And let's see if they accept Medicare assignment. Let's see if you're in one of the states where excess charges are completely irrelevant because they're illegal in that state. If so, let's look at Plan N and show you just a little bit beyond what the cheesy agent will show you, which is Plan G is easy, baby. It's easy. Let's sign up, covers everything. Let's go. 10 years ago, agents were doing the same thing, the scare tactic on Plan F. Plan F is the way to go. It's the Cadillac plan. It covers everything. Let's go with Plan F, baby. It's the Cadillac plan. Let's go with it. And as I chronicled over the years, a website called PlanGisBetter.com 10 years ago, I showed that Plan G was better than Plan F in every regard when you look at next year and the next year and the next year. Why was that? Because Plan F was the designated guarantee issue plan. If you got kicked off of IBM, left your employer plan, UPS, AT&T, all the people being kicked off their employer plans after age 65 got suddenly dumped into a guarantee issue repository on Medicare supplement. They could get but one plan, guarantee issue. What was that plan? It was Plan F. However, when the MACRA law came into effect in 2020, that designated plan turned into Plan G. So now agents are saying the easiest, simplest plan you can sign up for is Plan G. It's the simple one. It pays for everything. Okay. Well, here we're looking at a difference of $315 a year that you're going to pay more if you sign up for the least expensive in your area. It could go higher than that. We always look for the best value. So I'm just assuming it's one of our good agents and they're looking for the best value for you. And they're looking at, let's say this company right here, it's $315 more for you to have a Plan G than a Plan N. And that's in the first year. But what happens beyond that? Here's where it gets interesting. Real interesting. Oh, but wait, you're going to say, wait, you can't compare apples to apples though, Chris, because Plan N has co-payments. We got to be afraid of those $20 co-payments. And for the non-educated people out there who've never taken the time to really look into Plan N, those are the agents that are pushing only Plan G, I'll share with you a little secret. Those co-pays are not $20. Look at the small print. It says up to $20. It's actually 20% of the bill with a ceiling of $20. And that's not the bill, baby. That's the Medicare adjusted amount. As we looked at before, an $80 Medicare allowable amount, if you pay 20% of that, you're not paying $20. You're not. So let's look at the $315 saved if you went in this scenario, in this zip code. And remember, the rates are different in every zip code. We can tell you exactly what they are in yours. I'm just looking as an example of this zip code for this 65-year-old person, okay? The difference between Plan F and Plan G and Plan N was $315.96. Well, let's look at the worst case scenario from an agent who doesn't know any different and says that it's a $20 copay every time. Okay, and that's why we have a conversation and we listen to our clients. This would mean that you could go to the doctor's office almost 16 times a year and then and only then break even with what you've paid in extra to have that Plan G. The Plan G pays everything. Okay, is that really the best plan for you? Maybe not. And here's the other consideration. What we've actually seen in actual experience of writing Plan N, because we looked into it, is it's actually only an average of $14 copay when you go to the doctor. And not all visits, by the way, have a copay with them. If you go to chemotherapy, televisits, and others, there is no copay involved with that. Physical therapy, no copay. There's no copay. This is a new thing you're going to the doctor for, a follow-up treatment at a doctor's office for specific things that might have a copay to it, with an average of $14. So that means this patient, 65 years old, in their first year, they saved $316 here, and they could go to the doctor's office 22 and a half times and still only then break even and justify having paid the Plan G rate. If you go to the doctor 5 times a year, you saved a lot of money on Plan N. If you went to the doctor like most men do, maybe once a year, maybe twice, you saved a lot of money on Plan N. But wait, there's more. And here's the bottom line that they're not telling you, either based on ignorance or lack of experience. Wait a minute. I just shared with you, it's 22% commission, right? So what does that mean by the way of commission? Well, on Plan G, I was the agent, wrote this case. I'd make $24.54 per month for as long as you're on that plan. This is the part they don't want you to know. If I wrote that same person on Plan N, however, I'd be making $18.76 per month. That's a significant difference. $225 a year. By the way, just for those people who love Medicare Advantage, and that's the only thing that they help people with, the first year on Medicare Advantage for 2023, as I'm making this right now, I would make $601 for bringing that 65-year-old into a Medicare Advantage all-in-one, and I say Medicare Advantage with air quotes, Medicare Advantage plan, a complete replacement for Medicare. You should see our other video I just did on that, Medicare Advantage, and how to find a plan and what to look for. But if you go on Medicare Advantage, that agent is making a minimum of $601 higher in other states. So right now, I'm just comparing apples and apples. I would make $295 on a Plan G sale, and I'd make $225 on a Plan N sale. So certainly by going deeper, by asking more questions of our potential clients and finding out more about them, I'm actually making less money if I make the appropriate recommendation. On the flip side of that, those people who are only recommending Plan G in each and every case may be doing it for a financial incentive, and here's why. In our office, we do about 1,000 new clients each and every year. Many of the other agencies and stuff that you see on YouTube that are marketing heavily and doing direct mail and all the others, they'll do about the same. That is bringing in 1,000 new clients a year. This is a difference, if you multiply out this difference here, of, again, 27% difference in how much I make if I'm doing more Plan N versus Plan G. Plan G, I'm making a heck of a lot more. And here's how to see that graphically. If you multiply this out over just a 4-year life cycle of doing 1,000 clients a year, my agency just talking about Plan G, because it's just so simple, it's just good for the people, I'm just doing the right thing for the people, right. And you're making a heck of a lot more money just by talking about Plan G in the year 2020 and beyond after MACRA. Look at those numbers. So here's the little secret that people who don't work with their clients after they're turning 65 just don't know. Before I share this with you, I'm probably getting in trouble for it. And so if you see a blip in the video, that's because I've had to go back and delete a portion of it. If I get in trouble with the insurance companies, I sure hope I don't, because I want to share with you the full facts. I'm going to show you some rate increase examples that we track these every month, every quarter, every year with all the carriers from coast to coast. We track the rate increases. And this is the determining factor between an experienced agent or an agent who wants to get you in, get you off the phone and make the commission and get done. Because we follow up with our clients every year when the renewal happens. And by following up with them, we see the impact of these rate increases. And yet we know for a fact, because we hear about it all the time, so many agencies exist only to treat you like a king and a queen when you're brand new to Medicare. You're turning 65. That's what my whole YouTube channel is all about. You're turning 65. You're turning 65. That's great. They don't know shinola about underwriting or getting you into a better plan or doing a rate review with you at your anniversary date or any time, because as a Medicare supplement agent, we can help people with this 365 days a year. There is no season for saving money on Medicare supplement. So if you're in a Plan G and you don't know what to do and you don't know if it's the best plan for you, call my office. We'd love to look at it for you. And it doesn't cost anything for us to do it. If we write business, great. We'll only do so if we're putting you in a better position. Here's the secret sauce right here. And let me make it smaller. Look with me, if you would, on Plan G rate increases, okay? South Carolina, Utah, Kentucky. 18%, 15%, 18%. Same people, same population, same ages, same company, everything's the same except Plan N, 5% for South Carolina this was, 0%, which we often see in Utah. That's 1,500% less than the Plan G rate increase was. Why is that? Actuarially speaking, I can tell you why. Because there's so many people going into Plan G based on guarantee issue. Again, that's the plan that the government says you can have guarantee issue if you get kicked out of a Medicare Advantage plan or lose it by moving out of state. That's the plan that you can get guarantee issue with no underwriting whatsoever. If you're late to Medicare later on, you got kicked out of an employer plan, you can't get Plan N. You can get Plan N one of two ways. When you're new to Medicare, or if you go through underwriting through somebody smart like my agents that work for me at Senior Savings Network. We know what the questions are. They're very simple to pass underwriting, and you can get into a plan that's not only 27% cheaper every month, but look at the rate increases. And what did these rate increases do over time? Glad you asked. I'll show you. Here's another example. Virginia with Mutual of Omaha brand there. Plan G went up 9%. Plan N went up, there it is, 0%. Here's some more examples, folks. Colorado, Plan G went up 14%. Plan N goes up 0%. Now, I guarantee you the agents that are only focused on turning 65 business just don't look at these rate increase notices. We do, and we catalog every single one of them at my website called plannmedicare.org. So you can constantly see what's happening with these two plans and then make your own call. Here's one, another one from Utah, a different company. Plan G and Plan N both went up at the same rate there. So that does happen. However, the majority of these are like this. Plan G, 8% with a Mutual of Omaha brand in Texas. Plan N went up half as much. This is an Aetna rate increase notice. Plan F went up 9, Plan G went up 8, and Plan N went nowhere. No rate increase for you in Plan N. You're in a better risk pool. You're with people that are more than likely to be healthy because they went through underwriting. That's the difference. Healthier people don't opt to have a potential possible $14 or $20 copay. They just don't. Unhealthy people want the all-you-can-eat buffet of Medicare supplement, which is, sign me up for that Plan G, baby. I'm going all I can go in. And the rates reflect that. Here's one more. North Carolina, 12% on Plan G. That's a 1,200% differential between Plan G and Plan N. How many times the other agent with all out of breath telling you that when they're only talking about Plan G? This is analysis we did last year. Robert in my office did this. You'll see Plan G rate increases in the red. You'll see Plan N rate increases often negligible or none at all in the gold here. So again, an agent's income, if you're focused only on Plan G, is going to be 26.7% higher than if you're just focused on doing the right thing for the client and letting them choose. So the rate increases really are the dirty little secret. And here's what that looks like on a graph. And this is why when our clients call me and they've been scared to death by the person who's on YouTube paying all this money to get in front of all your eyeballs every day saying, you've got a choice between Medicare Advantage or Plan G. Medicare Advantage or Plan G. Those are your two choices. It's either one or the other. Go with Plan G every time. Really. Here's what happens if you went on this Plan G. I'm using the same examples from before, but let's look at just a mediocre. And you saw oftentimes Plan N has a 0% rate increase, 0, 0, 0. Let's give it a 3% rate increase and look at the trend line over just 5 years. I always anticipate that my clients are going to be on Medicare for a lot longer than just 5 years, especially if we were gracious enough they were to give us their business at age 65. But let's just look at a 5-year horizon. And you tell me if it's going to be affordable if you sign up with the Barker on YouTube at $111.58 today, but then you don't hear from them in year 2. You don't hear from them again in year 3. You don't hear from them again, and that rate goes up. This is just 9%. You saw the other ones. That's worse than this. You see the rates go up to $203, $222 a month. Meanwhile, your Social Security with inflation is actually a negative increase every year. So let me ask you this question. In this scenario, would you rather be on the red line because an agent quickly talked you into the most simple plan out there possible and put you on that plan G and took 27% more commission to do so and just said, wham, everything's taken care of. Don't worry about those copays. That excess charge plan will get you in those excess charges. Or would you think it's worth taking an extra 15 or 20 minutes for one of my agents to explain to you how Plan N might be affordable for you, not only today, saving money today, but down the road when it really counts? And you look back and you refer, like Nicole's in there right now, sending out 60 thank you letters, cards she handwrites to people who just referred people to us in the last few weeks. Why does that happen? Because of rate stability, because of doing the right thing for people. And see, this is where our vast majority of clients are on, a much smaller trend line. Now let's look at something that's actually more realistic. And what's more realistic, and I'll give Plan N 4% here, which is even more than what it's doing, really. But Plan G being at 12% is way more realistic. And after 5 years, you tell me, do you think it's going to be more appropriate for you to stay on that Plan G? And the little secret about Medicare supplements is, and as much as we want to help people that get on a Medicare supplement plan in future years, if their agent is an orphan agent, I mean, they just disappeared after you turn 65, which we hear so common. We can't help you change to another Medicare supplement plan. In the vast majority of states, there are some examples of differences here, like Nevada, Idaho, New York, Washington State, Oregon. They have states with guarantee issue opportunities every year. Missouri is another one. But in the other majority of states, you have to go through health underwriting, simple questions that we know the answers to, and we know if you would qualify or not. But if you can't qualify and you're not in one of those states, you're stuck and we can't help you. So to say that, oh, it's okay, sign up with me on Plan G, it's going to be fine. If you do get a rate increase to $220 per month, and that is insane, go ahead and call me back and I can help get you into a different plan at that time. I can get you into a Plan N at that time. Really? Well, if your crystal ball works that great, I need some stock tips from you. What happens in most of our cases is when somebody's desperate and they're calling us, as they do every single day, saying, I got in the wrong plan. I'm on this Plan G. It's going up so fast I can't afford it anymore. All I have to do is I have to give up my Medicare and go to one of those HMOs, which I know is not the best thing out there for me, but I just simply can't afford this anymore. And I understand, and my heart breaks for them. And yes, we do the Medicare Advantage plans, but only during one finite time of the year can you do a Medicare Advantage enrollment. And then every year, those plans change. Your Plan G or your Plan N will never change its benefits. They're locked in stone, just like a life insurance contract. It's a contract that is locked in. The only thing that's different, not locked in, is the stuff most agents are not telling you. This right here. It's the rate increase that's so vitally important. So yeah, I'd love to save you $315 the first year, but that's not what it's all about, folks. It's about the future. It's about how long you're going to be on Medicare and can you afford your own freedom any longer. So on Plan N, to just bring this together for you, yeah, it's super easy for an agent to explain. All you have to do is meet the Medicare deductible, which is only $226 for this year of 2023, and it changes every year a little bit, actually went down this year. And after you meet the deductible, your supplement kicks in. And on Plan G, baby, guess what? It's paying for everything. And it'll pay for those reckless excess charges that you'll probably never see a day in your life when you're on Medicare or on Plan N. Hardly ever would you see an excess charge. So it's simply a false flag to let you know that you need to make your entire Medicare decision based on excess charges that just don't exist in the real world. So yes, you'll pay 26% more a month on Plan G on average, and your agent makes more money. And your rate increases are guaranteed to be higher on Plan G. Or the road less traveled, you're going to have some copays. Typically $14 when you go to the doctor for a new event. $14. Wow. And those copays only kick in after you meet the Medicare deductible and your supplement starts. So it's up to $20, but it's really more realistically $12, $13, or $14 when you go to an office visit. And it's not a big deal because now you're in a risk pool of people who take their health more seriously or who got through underwriting and they expect to pay a copay in exchange for lower monthly premiums, lower annual premiums, and lower rate increases far into the future. It's worth the trade-off in most all cases. And if you go to the emergency room, it's $50 to go to the emergency room to disincentivize people for using the emergency room as a primary care doctor. I prefer a health plan that does that because it keeps my rate increases low. And if you get admitted to the hospital, you pay nothing because all Part A of Medicare, which is hospital inpatient, charges are paid for on a Plan N just like they are on a Plan G. So go into the hospital, your $50 from the ER is waived. Ambulance paid for, hospital stay paid for. Everything else functions just like a Plan G, except your wallet is fatter, especially in the future. You have potential for excess charges, which is minute. About 3% of doctors fall into that category where they charge excess charges, and it's no surprise. And there are 8 states which outlaw them. It's not going to happen. And if it is, it's no big deal at all. In exchange for having a plan that's affordable long into the future and saving money on day one. So if you've not been told the whole story by your agent, I encourage you to shop a different agent. We all have access to the same number of plans. We can all sell for all the different companies. The question that you have to answer is, who do you want to look out for you and be a strong advocate for you? Someone who's just spending $100,000 a month on YouTube to get in front of dog and cat videos and to very hurriedly tell you, be scared of excess charges because you can't go to the Mayo Clinic if you get a Plan N, which is bull hockey. Or take a deeper dive. Check out what I said. Look at Kaiser Family Foundation research on excess charges. Ask your insurance company right now, how often do you pay excess charges on claims for me? You're on a Plan G, you've been sitting there for years watching that rate go up. Ask the insurance company, hey, can I speak to somebody in claims? How often do you see excess charges come through that you have to pay or not pay? I know because I have dinner with these people once a year with Aetna, Cigna, and Mutual of Omaha. Every year we're having dinner with these people and I talk to the people at claims. And I know it is a non-starter. It is a base in fiction that tries to scare people into thinking, oh no, those excess charges are going to get me. I better listen to that agent and pay 27% more from the start and get rate increases of 14, 15, 18% because my agent told me this is the best thing for me and never told me about that Plan N because it takes longer to talk about Plan N. The agent makes less on Plan N, but maybe, just maybe, I can assign to the agent who would take the time a little bit more credibility than the agent who never did. My name is Chris Westphal. I'm here to help. I'll be answering questions in the chat. Thank you so much for participating and watching this video, especially to the end. I'm going to recommend some videos that I've got here at the end. If something else you want to find out about Medicare, I highly recommend subscribing for news and updates on Medicare, where the only bias I have is to make sure that you don't get screwed over as a senior on Medicare. God bless.